Chapter 4 is personal and professional qualities of a healthcare worker, which I think are pretty vital. Having professional and personal qualities is what makes us a good healthcare worker. And I'm going to break down some of those different qualities throughout this chapter. So, personal appearance is something that's very important. Now, I know we talk about all through life, how appearance isn't the most important thing, and it's not, obviously. But think about the first time someone comes in to meet you. If you're in the hospital and you're laying in that bed and someone comes in to address you, their personal appearance is going to matter to some extent. If they're clean or dirty, if they look like a hot mess, for lack of better terms, if they smell or what if they smell like smoke or something like that? So that personal appearance is going to matter. Appearance can absolutely communicate confidence and self-esteem. Um, you can convey a lot just based on how you appear. First impressions are really important, and they're mainly based on appearances and form really quickly. So, normally your first impression of somebody is formed within 20 seconds to 4 minutes. Now, that's a big window, but it usually is. And I mean, think about back to times when you've met people and what your first impression was of them versus how you feel about them now. Sometimes you're right, sometimes you're wrong. It just depends. But first impressions are important. And we form those based on the person's appearance mainly. I mean, I've definitely been the on the wrong end of the stick, I guess I should say, for people's first impressions. I've in my life always came across as, having that bad look on your face, and people just assume you're not kind or not nice when that's really not the case. But I mean, you want someone to look at you in your healthcare career and think, wow, I want this person to take care of me. So, healthcare is all about promoting health and preventing disease, right? So, therefore, us as healthcare workers, we should present a pretty healthy appearance. Now, that being said, I'm not saying everybody has to be skinny by any means, but I'm talking about overall health. When someone just doesn't look healthy. Now, imagine if you're diabetic and you're going to see a dietitian that's telling you how you need to eat to be healthy, and they're severely overweight, and they've got a soda sitting in front of them on their desk and a burger from lunch. I mean, are you going to look at them and think, wow, I really want to take health advice from you? Or are you going to think, who's this person telling me, what I should and shouldn't be eating? Now, regardless of what that person's doing, the patient's still diabetic and should be following those rules, but you kind of get my point. As a healthcare worker, we need to have a professional, healthy appearance if we want to convey that to our patients. So, the main factors in being healthy are diet, rest, and exercise. So, it's important to eat a well balanced, nutritious meals, provide the body with the material that we need for optimum health. Rest is very important. We need adequate rest to help give us energy and the ability to deal with stress. I'm sure that you've went into work before when you didn't get any sleep, and it's really hard to deal with those things. So think about when you're working in healthcare and you could have life and death situations on your hand. You could have, the ability to give the patient the wrong medication when you're overtired and, didn't read the label a couple times. So rest is vital. And then exercise. It maintains our circulation, helps improve muscle tone. Exercise is going to give us a better mental attitude. It'll also help with weight control and give us a more restful sleep. Good posture is also important. It helps us prevent fatigue and puts less stress on our muscles, but it also looks more professional. Someone who's all slumped over with their chin tucked down into their chest isn't going to convey as much confidence to the patients as someone who's standing tall and has good posture. We should be avoiding the use of tobacco, alcohol, and drugs. The use of all of those products can seriously affect our health, and the odor of smoke is very offensive to many individuals. And a lot of times, I don't know if any of you are smokers, but most of the time smokers cannot smell smoke on themselves. They don't think they stink. And I can vouch for that because I used to be a smoker and I didn't think that I smelled. And then now that I've quit smoking, the smell of smoke is very offensive to me. My husband actually likes to pick on me because if we go somewhere where they can smoke inside, I always complain. I'm like, oh my gosh, my hair stinks so bad. And he's like, you used to smoke, because I whine about it and I can't stand the smell of it. But it really is different when you smoke versus when you do not smoke, and being able to smell that. So the odor is really offensive to a lot of individuals. And think about it, if you've ever had a migraine, or aren't feeling good, if you're nauseous, those smells can really affect you. So imagine you're a patient laying on that bed and you feel like you're going to throw up, and the person taking care of you leans over to check your IV or get your blood or look at your wristband, and they smell like smoke, and it's so offensive it could make you vomit. How would that make you feel? So you need to take those things into consideration as a healthcare worker. And I'm not just saying, cigarette smoke, but there's a lot of other things too. I mean, showering, you think that sometimes that goes without saying, but, um, there are times as a clinical instructor that I did have to talk to students about personal hygiene and showering and wearing deodorant. I mean, you're reaching over someone to check their IV fluid bag, and you've got BO because you forgot deodorant that day. Um, that can be offensive to the patient. So, other than those things, even, even bad breath. I mean, right now we don't have to worry about that because everybody's wearing masks. But, if you're talking to someone and close to them and you've got really bad breath, it can be offensive to the patient. I've worked in a head pain clinic before, and these patients were people that had severe migraines or head issues, where it was causing them lots of pain. They were very light sensitive, noise sensitive, smell sensitive. I mean, perfume could just knock them into a migraine for days. Most hospitals actually have a rule that you're not supposed to wear scents, like scented lotions or perfumes, to work, because it can even trigger people's asthma. And a lot of times when we wear perfume, we become immune to it. We don't smell it anymore. So it's hard for us to really smell that scent on us. But going back to the smoking, tobacco can affect the function of our heart, our circulatory system, our lungs, and our digestive system. And most hospitals or healthcare facilities are smoke-free zones. So some of them go to the extreme of they will take a sample, and if you have nicotine in your system, they will not hire you. A lot of facilities are going to that. So they'll check to see if a person smokes. And a lot of them, there's no smoking on the campus at all. So even sitting in your car, you can't smoke. Other things that can kind of give us a professional appearance are our uniform. Depending on what you wear, if you wear scrubs or if you have to wear normal street clothes or a lab coat, whatever we wear should always be neat, well fitted, clean, and definitely free from wrinkles. If you wear regular clothing, it should be clean, neat, and in good condition. And also, it should be covering you. Working in the hospital, I used to always see women come in and they would have short skirts on, low tops, super high heels, walking around the hospitals, and that's where they worked. I mean, you need to dress professional even if you don't have to wear scrubs. Name badges. Most hospitals require employees to wear name badges at all times. Some of them even are used to gain access to different areas of the hospital, like the ER. They badge in, swipe your badge to get in. Those badges should be worn at eye level, so they need to be worn kind of on your collar or around a lanyard, on a lanyard around your chest, so that you can be easily picked out by patients or visitors. Shoes. This says white leather shoes of non-absorbent material such as leather. That's not always the case. Many healthcare careers allow different types of shoes. They should be closed-toed if you're working in any healthcare setting. Leather is a better option if you're going to work around any bodily fluids like blood or urine, where it could absorb through the soft mesh of normal tennis shoes. So as long as you have something that's comfortable and complies with your department, then that should be fine. Personal hygiene is essential because, again, like I said, working in close contact with patients, your body odor needs to be controlled. Bad oral hygiene, tobacco, perfume, and aftershaves can all be offensive. So those things need to be considered when you're working in healthcare. Do you think a uniform creates an impression on a patient? Do you think that that impression can be poor? Why or why not? So I want you to think about those things, especially, once you start going into your career and what you're wearing. So I'm going to show you some pictures of some differences in some uniforms. Tell me what you think. Well, actually, you can't tell me, but you can think it. So when I look at this first image, you've got the woman on the left that has, normal colored hair, natural colored hair, no tattoos, things like that, versus the woman on the right. Now, I don't have issues with either one of these, but some healthcare facilities do. Um, some healthcare facilities do not allow any unnatural hair color, so the purple hair would not be permitted by an employee. Some facilities won't hire people with visible tattoos. We actually have to be aware when we're placing students in some of our clinical sites for radiology, because we do have a hospital that does not allow tattoos. So we actually have to screen our patients, or not our patients, I'm sorry, screen our students before we send them there to make sure they have tattoos, because they will not hire them. So it just depends on the patient or the facility. So I have no problems with her hair, her tattoos, or any of that. My problems lay with her bracelet. This bangle is not professional. It would interfere with the patient care. It's not clean. So, if you're using gloves with a patient, it could touch the patient and could transfer contact from one patient to the other. The earrings are a hazard. They're not as professional, but also they can get pulled out easily. If you've got a patient, especially who has dementia or is in pain, a lot of times they reach up and grab onto things, and I've definitely known people who've had their earrings ripped out. The other thing that some facilities frown upon is the makeup. I mean, the red lipstick, it's really not that big of a deal, but some facilities might have a problem with it. And last but not least, with both the right and left picture of the lady, is her hair. A lot of facilities, and actually one I work at right now, if your hair is past your shoulders, it has to be pulled back while you're at work, because you can lean over a patient and your hair could touch them. What's wrong with this one, other than it looks like a cheap horror film? He is a wrinkled mess. So if you're bringing scrubs from home, they should be free of wrinkles and look professional. Now, that being said, I do wear surgery scrubs, and a lot of times the surgery scrubs come a wrinkled mess, and there's nothing you can do about it because they're laundered for the hospital. I guess you could bring some wrinkle away fabric stuff and spray it on there. No, that would be frowned upon. So what about this girl? What do you see that's wrong with this picture? Her scrubs are way too big. They don't fit her. It makes her look very young. Like when I look at this and I see her like that, it just makes her seem immature and very young. If she walked into your room to take care of you, you might not be very confident in her abilities. I spared you the real live picture of this, which, trust me, I could find them. This happens all the time. It's not as bad anymore. There was a period of time where med couture scrubs were really big, or iguanas, and they were so low cut that anytime you bend over, this would happen. So you need to make sure that your scrubs are fitting you properly. And if this is something that happens, because it does, make sure that you're wearing a shirt tucked in, or a longer tank top or longer shirt, so that if you do bend over, this isn't visible. It's very important to present an appearance that inspires confidence and a positive self-image for you and your patients. Your patient care is something that's going to be very important, and they want someone that's going to take care of them that they think knows what they're doing. When we go back into professional appearance, other things that we need to be concerned about are our nails. Nails should be short, clean, and natural. A lot of facilities prohibit the artificial nails or shellac or gel, anything that stays on for an extended period of time, because bacteria can grow under that and you can transfer from one patient to the other. So a lot of them do not allow that. Hair should be clean, neat, and long hair needs to be pulled back. Most jewelry is not permitted. It can cause injury to the patient or employee, and it can also transmit germs and pathogens. They do usually allow wedding rings, a watch, small stud earrings, like a little necklace, but if it's too much, excessive, or dangly, they usually don't allow it. Makeup and tattoos are going to vary from site to site. Excessive or unnatural makeup should be avoided. Tattoos that are visible or offensive can distract from professional appearance. I don't necessarily agree with that. Unless you have like something horrific written across your knuckles, or like you've got cuss words, tattooed on you visibly, I don't think tattoos are really that big of a deal. Most patients really tend to like them. I don't have any tattoos, but I've worked with a lot of people over the years that do. And honestly, I find the patients really are intrigued by a lot of them. So it's just going to depend on the site that you're at. There's certain professional and personal characteristics and attitudes that are going to apply to all healthcare occupations. When we talk about personal characteristics, we need to make sure that every effort is made to develop some of these characteristics I'm going to list, and attitudes, and help incorporate them into your personality to kind of be the best healthcare worker that you can be. So some examples of that are empathy. Empathy is simply the ability to identify with and understand another person's feelings, situations, or motives. So, putting yourself in their shoes, right? Can you empathize with them? Can you kind of understand what they're going through, even if you've never been in that same situation? Can you understand that person's feelings in that situation? So, if you can't be empathetic with a patient, I would definitely work on trying. It's a very good personal skill or characteristic to have. Honesty is very important. As a healthcare worker, you have to be truthful. You have to have integrity. Other people that you work with and your patients need to be able to trust you. We are all going to make mistakes. There's no doubt about it in my mind. Every one of you is going to make a mistake in your healthcare career. I have multiple times. But you need to be able to admit to them, even if you think that it could make you lose your job. If you're not telling the truth, it could injure or harm a patient up to, honestly, death. So be honest with yourself and admit your mistakes. A manager or a boss is going to be much more apt to have empathy for you if you admit it. I've made lots of mistakes, and I've walked into my boss's office and said, "Hey, I just totally screwed up. Can you tell me how to fix it? And I want to make sure that I don't ever do this again." They will respect you 1,000 times more by doing that than trying to hide it and then they find it later. And I'm telling you what, 99.9% of the time, they're going to figure it out, because there's so many steps past what we do as healthcare workers on the back end where these mistakes come to light. So just make sure you always own up to your mistakes. Another personal characteristic that's really important is dependability. We're working in healthcare. We need to be dependable. Our employees and patients need to be able to rely on us to make sure that we're there. You have to accept the responsibility that's required in your position. If you're someone who's late all the time, that's going to be a big problem. If you're someone who calls in all the time, that's going to be a big problem. So a lot of healthcare facilities have very strict rules on tardiness and call-ins. Some of them are so strict, you get a tick every time you're late, and if you're late 3 times and you get 3 ticks, you get written up and you can get fired. So it's something that they take very seriously. I always used to say, especially when I'm day shift, that midnight person has been working all night and they're ready for you to get there. If you're late and they come in and they have to wait for you every time, that's very disrespectful and frustrating for them. Same as you when you're working first shift and you're waiting for that second shift person to come in. If they're late all the time, it becomes very frustrating. So make sure that you're dependable and people can count on you. Another good personal characteristic is the willingness to learn. I've been doing this for 20 years, and I tell you what, I still make mistakes. I still don't know it all. I need to be willing to learn because, like I said, healthcare is constantly changing. So it's really vital for us to be open to those changes and learn new techniques or procedures. We have to be prepared for lifelong learning so that we can maintain a competent level of knowledge and skill to keep us going. If not, you're going to be left in the dust, and everybody that's willing to learn is going to pass you by. Patience. I can't say enough about patience. Now, I am not the most patient person at home. My children would probably tell you. I do get short patience and frustrated easily. But I'll tell you what, I am very patient when it comes to my patients in the hospital. So you have to be really tolerant and understanding. You're going to deal with a lot of different individuals. You got to learn to control your temper in difficult situations, or learn to deal with frustration and overcome obstacles. Um, you're going to have patients that can't communicate, which can be frustrating. You're going to have patients that maybe um, stutter and it takes them 20 minutes to tell you something. You're going to have patients that want to dress themselves even though it's going to take them a very long time. You may have a patient who hasn't had a conversation with somebody in weeks and you're the first person that they see and they want to talk to you about everything in their life. So just try to be understanding, and, you know, put yourself in that person's shoes and how they might be feeling, and give them just a little bit of your time. It can mean the world to somebody. Another personal characteristic that's really important is accepting of criticism. So, criticism's hard. Nobody likes it, right? Nobody likes to be told that they're doing something wrong or that they screwed up or that they're not good at something. Nobody likes that, right? But I'm going to tell you from this point forward, when you're going through school, when you're doing your clinicals for whatever healthcare career you decide to, when you're a new hire, even when you've been doing it for a long time, you're going to get criticism. You're going to get it from patients, families, employers, coworkers, doctors. Any of them could criticize you. I've got it from every single one of those people I just listed. Some criticism will be constructive, which is good. Sometimes people deliver it in the right way and say, hey, I noticed you're doing this, and I just wanted to tell you that maybe you could try this, or, it comes off the wrong way. Maybe you should try to do this. And if you get constructive criticism and it's delivered in the right way, it allows you to improve pretty easily, because delivery is half of the battle. And you can take that information from somebody who is kind and say, you know what, they're right. I could probably learn to change a little bit. But sometimes you're going to get bad criticism. I've definitely been yelled at by doctors in the OR before when they didn't like the way that I was doing something. And that's hard to take. But you have to just be able to brush it off. Now, I'm not saying that you should be treated disrespectful and just deal with it. But if someone's telling you that, they want you to do something a different way, their delivery might suck, but that's on them. That's who they are. Your response to their criticism, you need to stop and ask yourself, am I doing something that I shouldn't? Or could I be doing it better? Or am I not doing it the way that they want? Don't worry about their delivery, just worry about you and your actions. So instead of becoming resentful, try to be willing to accept that criticism and learn for it. That's going to help you a long way in your career. I've dealt with a lot of students over the years, and some of them accept it really well, and some of them don't. And when I've given constructive criticism to students before, the ones that it's hardest for me to deal with are the ones that make excuses for everything. Don't make excuses. Just listen to the person that's talking to you. It may come in a good way, it may come in a bad way, but listen to their message and really try to think, is that something I do? Is that something I could grow or learn from? Another good personal characteristic is enthusiasm. So you should enjoy your work and display a positive attitude. Now, I know that that's really easy to say, and you could go into your work every day and you're not always going to enjoy it and love it. You don't have to love every aspect of your job. I always tell people there's a difference between what you do and your job. Your job is the place you go to for your job, right? For what you do. It might be the hospital. Maybe you don't have the best manager, or maybe a coworker that you work with you don't get along very well. So you don't have to love every aspect of it, but you can focus on some of the good, some of the positive things. Like, I might not love my job, but I love what I do. And I know that kind of sounds weird, but I love x-raying patients. I love taking care of them. I love trying to get the best pictures in the easiest way for them so that they say, wow, that wasn't so bad, or I didn't think that, I thought that was going to hurt a lot worse, or thank you for taking good care of me. That is what I love. There's a lot of other things that I don't. So I try to focus on the positive points of that because it's going to help me not worry about those negative things so much. So trying to keep that positive attitude is really important. Self-motivation or self-initiative. This is a huge, huge personal characteristic and something that I find very important in students. So self-motivation or self-initiative is the ability to begin or follow through a task without being told to do so or needing constant direction. So you should be able to determine things that need to be done and just do them. I always talk about students I've had in the past where like I'll have two students and one of them stands in the corner of the x-ray room and just stands there and waits for someone to tell them to do something. And the other one, as soon as they know that there's a patient, they'll say, "Hey, what's that? Can I do that? Can I go?" Think about from the technologist or the management's perspective of those two students. That one that stands in the corner who doesn't ever say anything versus the one that says, "Can I do that? What's that? Can I help?" That person is self-motivated and the other person is not. They're going to want to take that self-motivated person and kind of help guide them because that's who they would rather deal with and work with. So it's very important in your career to be self-motivated. Something else that's important in life in general, not just healthcare, is tact. Being tactful means having the ability to say or do the kindest or most fitting thing in a difficult situation. Think about it for a second. Are you tactful? Probably depends on who you're dealing with. You know, my best friend, I might not have as much tact, but my coworkers and my patients, I'm absolutely going to be tactful. You're just implying that you have consideration for the feelings of others. I'm not saying I don't have consideration for my friend's feelings, but she usually wants to be told how it is anyways. But, you know, I mean, we don't want to look at a patient as a dental assistant and say, "Wow, your teeth are really jacked up. You know, maybe you should think about getting braces." You know, there's different ways to handle it and say things to people to be considerate. I had to use tact one time when I had to talk to my patient, or I'm sorry, my student about offensive body odor. You know how hard it is to sit somebody down and tell them that they have body odor and that they need to try to do something different. There's no easy way to say that, but being tactful and trying to be considerate of their feelings was the only thing that I could do. Competence. Competence means that you are qualified and capable of performing a task. You follow instructions, use approved procedures, and strive for accuracy in all you do. But it also means that you know your limits and also ask for help if you don't know how to perform a procedure. Now, as a student, you're not going to be 100% qualified and capable of performing a task. You're going to need help. But there is a level of competence that you will still have. Competence to know that you need to ask for help, right? So make sure that you're competent. As you grow as a student, you'll be able to do more things on your own. Responsibility. Responsibility simply implies being willing to be held accountable for your actions. That way other people can rely on you and they know that you'll meet your obligations. Simply, responsibility just means that you do what you're supposed to do. Responsibility is something that's very important in healthcare careers. You know, they want to be able to trust you. In some situations, again, you're dealing with life and death. Another personal characteristic that's important, personal characteristic that is important is discretion. You must always use good judgment in what you say and do. You have access to people's confidential information, and HIPAA requires you to keep it confidential. So you need to be aware of what you're saying and what you're doing and where you're doing it at. Protect your patient's information at all times. And then being a team player. So no matter what healthcare field you go into, you're going to be part of a team. So it's essential that you work as a team player. You got to learn to work well with other people. Play nice. Play well with others. Each member of the team is going to have different responsibilities, but if each person doesn't do their part, then that's going to cause a problem, and the patient's not going to get the best quality of care that they deserve. So when we go through and look at some of these, after the ones that we've talked about, which characteristics or attitudes need to be improved in the following situation? So a geriatric assistant is constantly late to work and calls in sick many weekends. What characteristic do you think that they need to work on? If you said dependability, you are correct. The next one is a dental assistant tells the patient your teeth are really crooked and ruin your appearance. What characteristic do they need to work on? If you said tact, you are correct. A sonography student never gets up when a patient needs to be done. The sonographer always has to ask them to do the patient. What does that student need to work on? Self-motivation is correct. A medical assistant can't hear the blood pressure, so they just guess. What do they need to work on? Honesty. Um, I know that you probably read that and you think, no way, a medical assistant's not just going to guess. But I've actually known people that have done that on manual blood pressure cuffs. They're like, I couldn't hear, so I just wrote something down, which is absolutely horrific. Because if a patient has high blood pressure and it goes undetected, they can obviously lead to a stroke or other medical issues. And that's, that goes back on that medical assistant or that healthcare worker. Um, Healthcare workers need to have effective communication. Communication is vital in all healthcare careers. I want you to think about a time where someone might not have communicated well with you. I go back to think of one of my first doctor's appointments on my own as a young adult. My family doctor just retired and somebody new took over for him, and I was not feeling good, and I went in, talked to the nurse, told him everything that was going on. The doctor walked in, barely looked at me, barely talked to me, listened to my lungs, looked in my ears, did a couple things, and then was turning to around to and said, "All right, you're all set," and was turning around to walk out the door. And I was like, "Would you like to tell me what you thought was wrong?" And he's like, "Oh, yeah, you have an upper respiratory infection," and turned around and walked out the door and didn't even let me make a comment. Now, I walked out the door and took my medical records with me and never went back. But that patient did not have, or that doctor did not have any sort of communication with his patient. So I want you to think about if you've ever had a situation where you felt like someone who was taking care of you was not communicating with you efficiently. Imagine if you're a patient and you're waiting on tests, or you don't know what's going on, or if you're going to be discharged, or if you've got to have another procedure, and nobody's communicating with you. And then someone comes in to get you to take you for something, and you have no idea what you're going for because nobody told you. So communication is vital when it comes to healthcare. Healthcare workers need to be able to relate to patients, families, coworkers, and others. Communication skills can assist you in this process, obviously. Communication, simply put, is the exchange of information, thoughts, ideas, and feelings. And communication can occur in a lot of different ways. It can be verbal, right? We can say it. It can be nonverbal with expressions or gestures, or it can be written communication. And all three of those are very important. So, all three forms of communication can be used in healthcare, and a lot of times we do when we're dealing with different types of patients. Um, we speak to them, also giving them nonverbal cues while we're talking to them, like smiling at them, using hand gestures for them to understand what we want them to do. And sometimes, if a patient can't communicate at all, we'll give written communication, or when they need to sign consent forms, we'll have written communication with them. So, nonverbal communication is very important. A lot of people think that just what we say is important, but our body language, our touch, our facial expressions, those are something that are very important and a lot of times can convey a completely different message than what we're saying. So, research has shown that a large percentage of communication we do is nonverbal. So, think about when you talk to people and when they're saying things to you and the faces that they're making and their hand gestures. Have you ever had a conversation with someone where what they're saying doesn't match with what they're looking like or what their body language is? I'm sure my husband would probably agree when there's times where I'm sitting there with my arms crossed and he asks me what's wrong and I say, nothing, I'm fine. Now, obviously, what I'm saying and my body language are not matching up. So, It's really important in healthcare to make sure that we are actually paying attention to our patient's body language and not only just listening to what they're saying. Because a lot of times you can find um, different information in what their body language is. So when we talk about communicating with people, the process seems fairly simple, right? You just tell somebody something, they listen, and that's that. But it can be a lot more complicated than that. So for the communication process to occur, there needs to be four essential elements. There needs to be a sender, someone who's giving a message or conveying the information to another person. A message, which is the information, ideas, or thoughts. There needs to be a receiver, someone that you're communicating to or who's going to receive the message from the sender. And then there also needs to be feedback. Feedback, simply put, is just a method that we use to determine whether the communication was successful. And that whole process can be verbal or nonverbal, right? So if you have a sender that says hi to an individual, hi is the message, I want to say hi to you. There's a receiver, another person who gets my message, and they say hi back to me. That's a complete communication process. It can be as simple as that. It can be as simple as a nonverbal communication. Have you ever been walking, somewhere and you see somebody and you wave at them and they wave back and that's all you do? So you said hi to them essentially, but that whole communication process was done in a nonverbal way. So it does seem pretty simple, right, when we sit and talk about how easy that was. But there's a lot of different factors that can cause poor communication or interfere with that process. So it's very important that the message is clear. Okay, so I'm not just talking about in your daily life, I'm talking about communicating with your patients as well. So, for that message to be clear in the healthcare setting, it needs to be in terminology that both the sender and the receiver can understand. As a healthcare worker, we're going to know a lot of technical terms that the patients aren't going to understand. And a lot of times, if you use those terms with the patient, they may be too scared or embarrassed to say that they don't know what you're talking about. So a lot of times they'll just shake their head or agree, but they really don't know what you're saying. And sometimes medical terminology can be scary to patients. So it's important that we make sure that we speak to them in terms that they can understand. I've always said you should talk to your patient on a fifth grade level. Now, that does not mean talking to them like a child or talking to him like a baby or talking down to them. I have a son in fifth grade right now, and him and I have very normal conversations. I don't talk baby talk to him. I don't talk to him like he's stupid. We have very real conversations, but I'm not going to use terms that he doesn't understand. Um, so it really helps patients a lot if you do that. It's hard for students because when they're first learning all these new terms, they want to use them. And I have to tell students a lot, like, no, rein those medical terms back in because the patient might not know what you mean. So, also, the sender has to deliver the message clearly and concisely. So, correct punctuation and good grammar are really important. Tone and pitch is really important as well. So, when we're talking to a patient, we should not be using a lot of slang terms and things like that. I know you probably don't, but I always joke around, like if someone asks you a question, don't say IDK instead of I don't know. Um, I jokingly say that to my kids sometimes, and they just look at me like I'm completely stupid, which I know I am being, but no, there's a lot of slang terms that we use in our real life, and you just have to be aware of what you're saying to patients because they might not understand them if it's not something that they use frequently as well. Tone and pitch is important. Again, like I said, you don't want to talk baby talk to a patient. Some of my big pet peeves are, calling patients sweetie and honey and things like that because it's just not professional. But you could actually irritate people by talking in that high pitched tone because people don't want to be treated like a baby. But also an angry tone or an irritated tone, the message isn't going to come across as clear because the patient's going to be focusing more on your tone than the message itself. So the receiver has to be able to hear and receive the messages, right? If we're trying to tell somebody something, if we're trying to convey a message, we need to make sure that they're able to receive that message. So if a patient is heavily medicated, they're not going to be able to understand or remember that message. If the patient's hard of hearing, they might not actually hear you. Or if patients have limited English speaking abilities. So you got to make sure that the patient is truly receiving that message. A lot of times, especially if patients have limited English speaking abilities, when you're talking to them, a lot of times they're just going to shake their head like they're understanding. So we assume they understand because they're shaking their head, but they might not truly. Or if you even ask them, do you understand? Yes might be the only word they know. So trying to get them to give you feedback and tell you that they understand it or explain things back to you will help. If you've ever had a procedure where you've been medicated, like a surgical procedure or your wisdom teeth removed or something like that, you'll know that you always have to have someone with you. One, that's to drive you because you can't drive after you're medicated, but also it's to give discharge instructions or to give the instructions to, because the patient isn't likely to remember them if they were heavily medicated. So a lot of times they also like to give those messages um, in front of the person who's with them so that they can help them remember. The receiver also has to understand that message. So again, using that unfamiliar terminology can cause a breakdown. The other thing that can cause a breakdown in understanding the message is the receiver's attitude or prejudice, can also interfere. So, I mean, if you're talking to somebody you're mad at, are you truly listening to them? Think about a time when you have been in an argument with somebody. A lot of times when you're in that argument, you're not really listening to what that person's saying. You're just waiting for them to stop so that you can tell them what you want to tell them, right? So, if you're in the hospital and the patient is highly irritated or upset about something, maybe they've been waiting a long time or they don't think they're getting good care, and then you're trying to talk to them, they might not actually be understanding what you're saying because of their attitude, because they're so upset at that point. Also, prejudice can interfere. If a person doesn't like you because, whatever reason they may have, they might not actually understand the message because they're not open to receiving it from you. So, when you're communicating with people, it's really important to avoid interruptions and distractions. So, if you're having a conversation with someone and answering a phone or writing a message down while you're talking to someone, it can absolutely decrease the effectiveness of your communication. Loud noises can also be a distraction. Like if you're trying to talk to a patient in their room and their monitors are beeping constantly, it's very hard for patients to understand that message. Um, I actually have a job where I fit patients for life vests. They're external defibrillators. I do education for them. And a lot of times, if I'm educating patients, if they're in a double room and the other patient on the other side is talking and their monitor's going, you can just see in that patient that they're really struggling to hear what I'm saying. And some of them will even come out and say, I'm sorry, I'm just really having a hard time hearing you because of the noise. I always try to shut the door when I'm in a hospital, when I'm talking to a patient, make sure the monitors are on silent if they can be, things like that, so that those things aren't interfering. If you are trying to communicate with a patient and you have to answer the phone, make sure that you let your patient know, I'm so sorry, give me just a second, I have to take this phone and I'll be right back. Do not try to do both things at the same time because it's just not going to end well. And then also, if you're taking notes with a patient, make sure that you're looking at them while you're doing it and look at them, have the conversation, and then write the notes down. If you've got your back to your patient while you're writing notes, you'll ask them, hey, oh, so what's going on? Give me a little bit of history. Why are you here? And you're not facing them while they're talking to you, you're going to miss out on a lot of things. One, you might miss out on the communication. Two, you're definitely going to miss out on the nonverbal. So they may be pointing to where their pain is, and it may be different than what they're saying. So you're missing out on a lot of things. So make sure that if you're communicating with a patient, you're communicating with them. And then when you're done communicating, then you write the things down. So you're not trying to do two things at once. Because I don't know how many times When I'm trying to do something, if I'm typing an email or something like that and someone comes in to talk to me, they may be talking to me, but I'm not hearing a word of what they say. There's been times where my husband says, "Do you realize you just told the kids that they can do, something random that I would probably never let them do?" And I'm like, no, I didn't, because I wasn't really listening to them. So make sure that you're focused on that person and have a good communication process with them. Listening is also essential to communication, and it seems pretty simple, right? We just listen to people, but it doesn't always go that easily. Listening means that you're actually paying attention to and making an effort to hear what the other person is saying. So a lot of times we listen to them and we might hear the words, but are we really taking into account what they're trying to say? So when someone is talking, you need to hear what they're really trying to put out there. Not just the words, but what's the meaning? What are they trying to say? What message are they trying to give you? Make sure that you're alert and making eye contact. And that's a big thing. If you're talking to someone, especially about something important, if you go into the hospital and you're not feeling good and you're trying to give that message to somebody and they're not looking at you or, you know, giving you feedback, you're probably thinking, do they even give a crap? I mean, they're not even paying attention to me when I'm trying to tell them why I'm at the hospital. So be alert, make eye contact. They are your priority when you're communicating with them. Try to eliminate any prejudice and see the other person's point of view. Avoid thinking about how you're going to respond. And that's a big one. And it kind of goes back to when I was talking about, you know, fighting with someone or having a heated conversation. Or my son, who only wants to just say what he wants to say and not really listen to me. So when someone's talking, listen to them. Don't try to think of what you want to say next or what you're going to do. Listen to what they are saying. Listen to the words that are coming out of their mouth. And then sometimes you can actually reflect the statement back to the patient, especially in healthcare, and you're doing like handoffs or things like that with patients. So if you have a nurse that comes in and says, "Oh, this is so and so. They're on 2 liters of oxygen. They're feeling nauseated, dizzy, blah, blah, blah." You can repeat some of those things back to them. Okay, so they're on 2 liters of oxygen. They're dizzy upon standing. That way, you know that you're getting the correct information and that they're going to tell you that, yes, that is correct. Things like that are really important in healthcare because you can easily mishear or misunderstand something. So by repeating it back to the person, you know if you got the correct message or not. Also, make sure that you're watching the speaker very closely, observe their actions because they absolutely can contradict what they say. And like I said, you could have someone who says, a patient, "Oh, I have stomach pain." And when they point, they're pointing up more towards their sternum. So it's not really stomach pain, it's more chest pain. So we can miss out on those important cues by not looking at the person when we're talking to them. The other thing that we want to make sure is we keep our temper under control and maintain a positive attitude. You are going to deal with angry patients in healthcare. That's just how it is. But we can't match their anger. That doesn't do anything. That doesn't help the situation at all. It just brings us to their level. So, what I've learned over the years is most people, when they're angry like that, especially in a healthcare setting, they're just upset because either they've been waiting a long time or they feel like they're not getting care. Those are usually the two main things. Um, so what do most people want when they're upset? When you're upset and you call your friend to talk to them, what are you wanting from them? You're wanting to vent, right? You're wanting someone to listen to you. You don't always want advice. Sometimes you don't even want people to fix it. You just want to be able to complain, right? So in the hospital, I feel like a lot of times it's the same thing. So if a patient's upset, we do want to try to fix the reason they're upset, but most of the time we just need to listen. Don't make excuses. Don't try to argue with them that that's not right. Just listen to them. If you've got a patient that says, "I've been waiting out there for an hour," and you know that they've been waiting out there for an hour, but they came 40 minutes early for their appointment. Their appointment, they've only been waiting for 20 minutes. It doesn't make much sense to just sit there and argue with them. Let them talk, listen to them, Acknowledge their upset and acknowledge their frustration. I'm so sorry that you waited that long. I totally understand. I don't like to wait either. That's so frustrating sometimes, and it can make you really upset. I totally get that. Give them that acknowledgement. Yes, I understand you're upset. I am so sorry. You know what? We're going to see if we can get you in for your appointment right now. I'm going to go check and I'm going to go see what I can do. And then follow up and communicate with them. Don't just leave them out there until someone comes and get them. Go back out and say, I talked to them. They know that you've been waiting. They're working as fast as they can. They've got another patient on the table, and as soon as they're done, they're going to come right out and get you. Again, I apologize. Is there anything else that I can do for you? Talking to your patient like that is going to get them in a better place. And that's what we want to do, right? We're in healthcare to give our patients good experiences. It's hard sometimes when patients are upset with us because we don't want them to be, and we don't want to be talked to in a rude way. But I know I've been in that situation before where I've been an upset patient. So my goal always is not to match their anger or to argue with them. My goal is to try to diffuse the situation. And in my head, I tell myself, you know what? They're really angry right now. By the time they leave, I want them to tell me thank you or have a good day or something along those lines. That way I know I've kind of turned them around. Does that make sense? I've had to diffuse a lot of situations over the years, and I've had a lot of different ones, but one of the more recent ones I had was a lady that came in and she was sick and she needed a chest x-ray. And I had to have her change. And she had her daughter with her, but she also had another um, person with her. So we do not encourage, obviously, them to bring children into the room because, one, it's radiation, and if they have to come behind the wall, there's a lot of things that they can push and hit. So I asked her to, can your child just stay with this other caregiver? And she instantly got upset with me. Well, she's going to be upset if she can't come with me. Well, I'm really sorry about that. I totally understand. My kids get the same way when I have to leave them. I said, but there's radiation in the x-ray room and there's no one to watch her behind the control panel. And she was young. If she was old enough to stand back there, even like 5, 6, I would have probably brought her. But I said, so for her safety, it's just better for her to stay right here. So she was really irritated with me because of that. But I try to let them know like it's for their own good. And I think that sometimes helps. But then I had to get her changed, and she was really mad about that. I don't understand why I have to change. If I don't feel good, do you really think it's smart for you to be making people get undressed when it's cold out? And I, again, apologize. I'm so sorry. I completely understand. I get cold all the time, too. Look, I have 3 layers on right now. I totally understand that. I can get you a warm blanket to walk from the dressing room over to the x-ray room. But unfortunately, if I have your sweatshirt on and your bra and your necklace and all those other articles of clothing, the doctor's not going to be able to see what's going on with your lungs. And we want to give them the best study we can. So, in order to do that, I need you to take your clothes off and put this gown on. Then I get her in the room and I find out where that frustration really comes from. And she starts to tell me about how her mom was at that hospital and her mom was sick and she didn't think she was getting the care that she needed. And then it all kind of clicks. She's not really mad at me. She's not really mad at the fact that I wouldn't let her daughter in. She's not really mad at the fact that she had to get unchanged. She's already got a prejudice towards that hospital because of something that happened with her mom. So it didn't matter what I did or what I said, she was going to be upset, right? So had I started arguing with her from the beginning, it would have just met the expectation that she had. So by the end of it, we talked about her mom. I, apologized to her, asked her how her mom was doing, went through that whole spiel. And by the time that she walked out the door, she apologized to me. And she said, I'm really sorry. I was just frustrated and upset. And thank you for helping me today. That's what I want. That's my goal. Because even if that patient's upset, what good does it do for me to be? I could have been like, well, sorry, your daughter has to stay. I don't know what to tell you. And I could have been like, well, too bad. We got to get your clothes off because you got to have this chest x-ray. I could have done all those things and it would have escalated the situation and it would have made it worse. And what good does that do anybody? So keeping your temper under control and just trying to de-escalate the situation with your patient, 99.9% of the time, if you just look at the patient and say, I'm so sorry, I totally understand, I can see how that would be very frustrating for you. Most of the time, just that acknowledgement is enough to be like, oh, okay, and help them. Not always. I mean, it's not always going to, but a lot of times it can help. So, nonverbal communication is, again, very important. It involves the use of our facial expressions, body language, gestures, eye contact, and touch, even, to give a message. So, it can absolutely conflict with our verbal messages, right? If you're saying, I'm so mad with a smile on your face, that's pretty conflicting. There's been times where my kids do something that they're not supposed to do, but it's really funny, and I'm trying to discipline him and I've got a smile on my face, and then they start laughing. It's a very bad cycle. I can't get across the fact that they shouldn't have done what they did because I'm laughing at them. So, um, it's the same thing in the hospital. If you're, smiling at the patient, but you're not being very friendly to them, or you're saying things that don't match up, it's going to be very hard for them to deal with. Same thing with your patients. So always make sure that you are aware of your own and your patient's nonverbal behaviors. And sometimes we don't even realize they're doing them. I remember when I was young, I worked at my aunt's restaurant. And I mean, when I say young, I was probably like 14, 15. A patient came up and she was probably what I thought was rude. I don't even know if she was because I can't remember. But I said all the right things to her. I don't remember what it was, if her order was wrong or whatever. I said all the right things. I corrected the order. I fixed everything. And a few minutes later, my aunt came up to me and started screaming at me. And I was like, what is going on? Apparently, I rolled my eyes at the customer. Now, like I said, I talked to her very nice. I fixed her problem. I didn't even realize I rolled my eyes. And I probably did. I'm not going to say that person was lying because I gave her what she wanted, so she had no reason to come back up and say that for no reason. So I got in big trouble because my aunt don't play. But I remember thinking in that situation, I didn't even realize I rolled my eyes. And I don't think I've ever rolled my eyes since that day because my aunt scared the life out of me. But, that's what I'm talking about. We might not even realize we're doing that. Some people have a look of disgust on their face and they don't even realize they're doing it. So make sure that your face is matching what you're saying, okay? A lot of times in the hospital, even if you're irritated, just smiling is going to eliminate some of those facial expressions that we have a hard time controlling. So just always be aware of yours and pay attention to your patients. It can help you in a lot of patient care settings. Um, I've had a patient come into my room one time, and if I had just talked to her and asked her questions and wrote them down with my back to her, I would have never noticed, that she was sitting there shivering. And I was like, oh, are you cold? Would you like a warm blanket? And she's like, actually, I'm all wet. She came over from the emergency room, and I was like, you're wet? And she's like, well, I had to go to the bathroom, but the nurse wouldn't come in, so I had to pee myself. And I instantly just felt awful for her because could you imagine? And she was a very capable young woman. She wasn't elderly. It wasn't that she couldn't get up. It was that the nurse didn't respond to her and she had to go that bad. So I got her up, got her a new gown, cleaned up her bed. I washed off her back with a warm washcloth and put a new sheet down and got her into bed and gave her a blanket. Now, that meant so much to her in that time. She could not stop thanking me. She was so thankful for that. But could you imagine if that was you? I mean, this woman was like in her mid 30s, okay? And this was like, a long time ago, probably 15 years ago. But she was in her mid 30s, and how embarrassing for her to know that you're fully capable of going to the bathroom, but you can't. I could imagine myself being in that same situation and how I would feel. And it took me 3 minutes, if that, to do what I did. And it made a world of difference to the patient. But had I not been looking at her, I would have missed her nonverbal cues of her shivering or, rubbing her arms to warm up. So pay attention to your patients. It's also going to give you a heads up if your patient is looking dizzy. You might see that beforehand. I've had patients who are about to pass out and they go completely white. They lose all the color on their face before they pass out or turn a grayish color. You can see those when you're paying attention to them. Obviously, I've been going on and on about it, so that should tell you how important it really is to make sure that you're paying attention to those nonverbal cues. So we don't always need verbal cues or verbal communication to communicate effectively. Um, when verbal and nonverbal messages agree, the receiver is definitely more likely to understand the message. But there's been times where I can communicate 100% nonverbally with patients. I've had patients that either are limited English speaking or have other things, and they can't communicate as well. So I will ask them things with nonverbal. I can make a bump with my belly to ask them if there's any chance of pregnancy. I can tell them how to lay down on my table by pointing to their back and putting it on the table, head this way, feet that way. There's a lot of different things that I can do to get my patient to understand me nonverbally. So if you look at some of these images here, they're giving some pretty clear nonverbal communication. So if you look at this lady, what's your first response? I usually get a lot of different ones. It's bored, it's daydreaming, it's lost in thought. But if you walk up to somebody that's doing that, you're going to instantly get a feel for what they're communicating nonverbally. What about this one? She's so excited, right? You can tell that. You don't need her to say anything. You can tell by her face she's so excited. What about with this one? I want you to think for just a second before I say it. I get a lot of different ones with this one, but to me, and what I was trying to convey with this is she's interested, right? She's leaning towards him while she's talking. She's making direct eye contact. She's got a smile. She is listening to what he is saying, and she is interested in what he's saying. I don't mean interested in like a love interest. It could be, but I mean she is having good communication skills with him. This one, obvious, right? She's yawning or she's bored. So sometimes we can really pick up on what a patient is trying to say just by their body language. Um, there's things that can get in the way or limit our clear communication, such as physical disabilities, psychological attitudes or prejudice, and even cultural diversity. These can limit or get in the way of us trying to communicate. So, some physical disabilities that can cause barriers to communication, deafness or hearing loss. Obviously, if a person can't hear, they're going to have difficulty receiving messages, right? So, at that point, it's very important to use body language and gestures or sign language if you know it. It's very important to face the individual, make eye contact with them, and speak slowly. Because if they're deaf, they may be able to read your lips. So looking at them and speaking slowly is very important. You may also need to get an interpreter, a sign language interpreter. Blindness or vision impaired, they can't see our nonverbal cues. So it's very important to improve communication. You want to use a soft voice, don't yell louder. Describe events that are occurring. Announce your presence, explain noises or sounds, and use touch when appropriate. So imagine if you were blind. And normally when we're in the classroom, I will have you close your eyes and then I walk around and randomly like push or touch somebody because I want you to understand what it would be like. If you closed your eyes and you were taken into a room and there's all these weird noises you've never heard before, and then someone just all of a sudden starts touching you, that's very startling. So it's important to talk to the patient and say, hi, my name is Stacy. I'm going to be doing your x-rays today, or I'm going to be doing your ultrasound, or I'm going to be drawing your blood. You're going to feel me touch you if you're maybe getting their blood pressure. Or I'm going to be putting a blood pressure cuff on your right arm. You're going to feel that. I'm going to move your sleeve. You're going to feel a little bit of pressure when it pumps up. I mean, obviously people have had blood pressure before, so they know, but Make sure that you're telling them what you're doing. You may hear some loud noises. Um, that's my ultrasound machine. I'll tell you if I'm going to do anything. When you're getting ready to put the transducer on them, you would tell them, all right, I'm going to put some warm gel on you. You're going to feel that. And then my transducer machine is going to touch you. You'll feel that moving around. Um, Always make sure that you're giving them an idea of what's happening, because it can be very scary to be in a new place and not see or know what's going on around you. Aphasia or speech impairments, people can have difficulty with the spoken word, but also written communication. So they may know what they want to say, but they may have difficulty remembering the words. They can have slurred speech or a stutter. So it's very important to be patient with them. Um, Sometimes, you can try to say what they're thinking and they can shake their head, but sometimes they may want to get that message out themselves. So, make sure that you're being patient. They can't help it, and it's probably very frustrating with them as well. The other thing I want to say that goes along with that is, just because a patient can't speak, that doesn't mean they don't understand. And that's my biggest pet peeve I've seen with coworkers over the years is, if a patient can't speak to them, they automatically just assume that they have no idea what's going on, and they speak freely with the other people that they're working with. And I think that is highly rude, disrespectful, and unprofessional. Just because they can't speak to you does not mean they're not fully aware of what's going on. So you should always remain professional in that room. There's some psychological barriers that may interfere. They may be caused by prejudice, attitude, or personality. Someone's appearance, lifestyle, or social or economic status can cause barriers to communication. If your patient has a prejudice, then they may be angry or upset, or they may not listen to you. So that can absolutely cause a barrier. So, as a healthcare worker as well, it's also important for you to respect all individuals and put any prejudice aside. Now, we all have a prejudice to some extent about different things. So, as a healthcare worker, it's so important for you to make sure that you're aware of those, because a homeless person deserves as much respect as a millionaire or a president. A meth addict deserves as much respect as someone who's healthy. Their lifestyle choices don't have anything to do with us. We are there 100% to care for every single patient with the exact same respect and dignity. It does not matter what we believe. If we don't agree with the fact that someone's a heroin addict, it doesn't matter. We still need to give them the best care possible. So, fear may cause anger or negativity. So, allow that patient to express their fears or anger. Encourage them to talk. Don't argue. Stay calm. And always talk in a soft, non threatening tone. And continue to give them quality care. 99.9, and I know I say that all the time, but um, they're not really angry. They're just scared. They're scared for why they're at their hospital. They're scared for what the results may be. They're scared if it's their loved one or their child. So let them speak. Let them get that out. Remember when I was talking about my lady that was upset? She was upset because of care her mom got, right? So it can be anger from care, but it can also be fear of what's going on. Some people just don't like the hospitals, period. Cultural diversity can be another barrier to communication. So, beliefs and practices regarding health and illness. A lot of different cultures have their own beliefs about what can cause an illness and how to treat different things. So, even if they are at the hospital you're working at, they might not 100% want the care that we would give them. They may want something different. So, we need to be aware of that. Obviously, we can't know all the different cultures and um, what they would prefer. That's just unrealistic to know all that. But being open to it is what we can do, and respecting their choices. Also, language barriers can cause communication issues. So, if someone has a language barrier and English isn't their first language, make sure you speak slowly, use gestures or pictures. And if they do not speak English, you have to find an interpreter. We have a lot of new devices around, like computer interpreters, where you can actually just pick the flag, like you can have the patient pick the flag of the country and it'll have the language that they speak, and they'll have someone that can interpret everything for them. Also, make sure that you're making eye contact, but in some cultures, direct eye contact is not acceptable. In some Native American cultures, direct eye contact can be seen as a form of hostility. So if you see that you're looking at someone in the eyes and they're constantly looking away, or they look like they're getting upset, make sure that you stop making eye contact with them. That's why it's important to pay attention to people's nonverbal communication. There's also some cultures that have different ways of dealing with terminal illness or disease. Some cultures, the patient isn't told about their terminal illness. The most elderly person in that family is, and then they decide how to deal with the care. So again, you might not understand that, but that's that patient's choice and what they want to do. Touch, in some cultures, touch can be considered disrespectful or inappropriate. So just again, be aware of your nonverbal communication from your patient. If you touch your patient and they shy away from you or look upset, then make sure that you take that as a hint and don't do it again. Or even communicate with them like, oh, I'm so sorry. Did that hurt you? Or does that make you uncomfortable? There's no harm in asking a patient. They may say, oh, no, I'm sorry, that hurt me. Or no, it's against my religion to be touched by, you know, someone or someone of the opposite sex. There's a lot of different things out there. So asking can't hurt. It will give you a better understanding of what's going on. So moving out of communication and into recording and reporting, which is still a form of written communication, it's our job as healthcare professionals to make sure that we're conveying the information that we get from our patient. So important part of effective communication is recording and reporting what we see. So to do that properly, we need to listen to what the patient's saying and also make observations about the patient. So we're using all of our senses in the process to make observations. We're using our sense of sight. We're seeing what's going on. Are we seeing things like bruises or lacerations, or are we seeing an agitated patient, or are we seeing a scared patient? We're using our sense of smell. Do we smell alcohol? Do we smell, sweat? Do we smell saltiness? There's a lot of different things that we can smell. We're using our touch. We're using our hearing. Can we hear their breathing? Does it sound raspy? A lot of different things are going into our observations on a patient. So it's important that we report things promptly and accurately. We need to make sure that we convey all that message so that the patient can get the best care possible. There's two different types of observation that we need to know of, and so make sure you know the difference between the two. There's subjective and objective. Subjective things cannot be seen or felt. They're called symptoms. So that means like a patient. A patient can say, oh, I have a headache. We can't tell that they have a headache, right? Or they have a stomach ache. We can't tell that they have a stomach ache. Or maybe they feel flushed or hot. Those are things that we can't tell. But we can write them down and document those because they're subjective. So we could say the patient states they have a headache because we don't know that, right? So an example of a subjective observation is Mr. Smith says he is very warm. We can't prove he's very warm. I mean, obviously we could feel, but we don't have a basis to compare that by, right? So we have a subjective observation by saying Mr. Smith says he is warm. Objective things can be seen or measured, right? We call those signs. Signs because we can see them. So signs could be bruises, cuts, rashes, things like that that we can actually look at and measure. So make sure you know the difference between the two. So we also need to understand the criteria for recording observations on a patient's health chart or electronic health records. So like I just said before, subjective observations that a healthcare worker feels or thinks needs to be avoided. If a patient states it, we can say it. So you can say patient states headache, patient states warm flushed feeling. We can't just state it as it's a fact though. Also, any errors, we shouldn't completely take out of their health records. Once it's in there, it's part of their record. So we need to just cross it off like with one line, and then you need to initial it so that it stays in there because it was part of the record, but it clearly shows that it was an error. So HIPAA regulations have established strict standards for maintaining confidentiality of healthcare records. Patients have total control of how their information and medical records are shared. Those are usually the forms that you sign when you first come in to the hospital, stating how you will allow your medical records to be used. Teamwork is another important part of working in the hospital. This was my favorite Pistons team, but I always have this picture up here and it says, can any of these players win the game by himself? Why or why not? And why are teams important? There's no way any individual can do the work of a team by themselves. We need each other. We need each person to play a vital role to make sure that everything's functioning as it should. And that's what we need to do for our patients. So in any healthcare career that you do, you're going to be part of a team. And our goal as a team is to provide good quality healthcare for every patient, right? So teamwork consists of professionals with different levels of education, ideas, background, and interest working together for the good of the patient. If you're going into sonography, you're going to be dealing with patients on the floor, outpatients, and ER patients. That means you're going to be dealing with ER nurses calling you, doctors calling you. You're going to be dealing with a transporter or a nurse's aide bringing the patient over to you. You're going to be dealing with the radiologist and their report. And then you may also be dealing with other departments at the same time. Maybe when they come over for ultrasound, they need a CT or an x-ray as well. And then it's going to be your job to communicate with the x-ray department to see if they can come over. The floor, you might have to deal with the nurse or the hospitalist or the transporter that's bringing them down. The front desk, you might have to deal with a receptionist. So we have to be able to communicate well with each other and work together as a team to make sure that we're giving the patient the best care that they could possibly get. Teamwork is going to improve communication and continuity of care for your patient. Every person on the team needs to understand their role of each team member. And a lot of times the leader is really important. A leader is usually going to be your team leader or your department manager. And it's really important to have good interpersonal relationships with other departments within the hospital. That's one of the best ways that you can do it. Are you going to get along with everybody? Probably not. Are you going to have miscommunications? Absolutely. But talking to them and trying to sort it out is the best thing that you can do. Conflicts are definitely going to occur, but instead of us just getting mad, we need to talk through them, see what happened, tell the other person how you feel, and kind of try to explain yourself, but stay positive and be open. Maybe they just misunderstood you. Maybe they've got a lot going on right now. Doesn't mean it's okay, but if we're open to that communication and open to resolution, then it's going to go a long way. Also, legal responsibilities are really important when it comes to teams and teamwork. So make sure you understand the legal limitations for actions of your team members or yourself. Leadership is really important. The purpose of leadership is just to encourage people to work together and do their best to achieve a common goal. There's always been a myth that leaders are born, but the truth is most of them develop from their efforts. Anybody can be a leader, right? They just want to be, they just have to have the drive and good characteristics. So some of the good characteristics of a leader are respect, dignity, listening to the opinions of others, understanding the principles of democracy, being willing to inspire and motivate others, understanding one's own strengths and weaknesses, and making sure that you're giving other people credit. There's three main types of leadership, and I'm sure you probably worked for at least one of these, if not all. There's a democratic leader who encourages participation of all individuals in decisions. So this leader listens to the opinions of others, then bases their decision on what's best for the group as a whole. So they might say, all right, let's take a vote. Who wants to do this? And they'll take the majority. Laissez-faire they believe in the non-interference of affairs of others, so they'll only strive for minimum rules or regulations. So most of the time, they allow individuals in the group to function in an independent manner with little direction. Like, okay, you guys just work amongst yourselves. Try to work things out on your own. If you can't, then I'll interfere. And then there's an autocratic leader, which is often known as a dictator. This individual maintains total rule, makes all decisions, and has difficulty delegating any tasks. They emphasize discipline and expect others to follow directions at all times. So, like, when you look at all three of these, all of them have their advantages and disadvantages, right? And like I said, I'm sure that you've worked with all of them. I'm sure no leaders out there are perfect, um, but most of them should be open to listening and getting feedback to improve on themselves. We can all improve on ourselves. So one of the questions that I always like to ask is, what do you feel might be a personal trait, characteristic, or attitude that you possess and may need to overcome in order to be successful in a healthcare career? Like for me, some of the things that I needed to overcome early on were my dependability. I was always late. It was hard for me to get up in the mornings. I didn't wake up. Um, those were things that I really needed to work on. And I had a short temper, to be honest with you. Um, I had a very short fuse, and that's something that I needed to really focus on. So I think self reflection is really good. We need to look at ourselves and we need to understand who we are and some things that may need to work on or modify to become an effective member of a health team. So it's really important for us to do a little bit of self reflection as a student. And like I said, as you get constructive criticism over your career path, don't just instantly be irritated by it. Listen to what those people are saying and see if you really truly need to make some adjustments. It'll make you a better person. I always like to end the slide with no act of kindness, no matter how small, is ever wasted. Even a smile in the hallways in the hospital can mean a big thing, or a hello. Those things can make a difference. Or talking to a patient. How are you doing today? How's it going? Or, I'm so sorry you feel that way. Those little things make a huge difference with a patient. And why else are we in healthcare other than to make our patients feel a little bit better, right? Please watch the video in the section. Well, actually, it won't be coming up for a little while, but I do have a video on compassion, and I really feel like it's a great video to watch. There is a forum on it that you'll be doing as well. So that's it for chapter 4.